GERD and IBS will now be rated separately, but there are some things to consider prior to submitting for your increase and getting these changed for your overall rating. There are basically 3 scenarios in which you would ask the VA to change your rating with these new changes coming down the pipe. Obviously, we want to ask the VA to change your rating because the changes would give you an increase, and that's really what we're going to cover here. As of right now, the only changes that are final are GERD and IBS, as well as hemorrhoids, which is effective May 19th, 2024. So since these changes have an effective date, we are going to use this as the example, but this applies for everything, okay? For these scenarios, we will establish that you are rated right now for GERD and IBS, and let's just throw hemorrhoids in there for the fun of it. Now, the VA ropes these together, but come May 19th, they are all separate. And no, the VA will not automatically separate these. And yes, if you decide not to do anything, then that's it. Nothing happens, okay? Scenario 1, you submit an ITF, an intent to file, right now. By doing this, it forces the VA to choose the rating in favor of the veteran. So if you would have gotten a higher rating based on the current or old way of these ratings, then the intent to file will protect your rating. If you would have gotten a higher rating for the new changes, then the VA would award you the highest rating. This is probably the most advantageous for the majority of veterans. This is scenario 1. Now, scenario 2, you don't submit an intent to file until after the changes go into effect. Once this happens, you submit a claim for an increase. You are subject to the new way the VA rates that condition. Looking at IBS and hemorrhoids, that seems favorable, but looking at GERD, it's a bit washy and not as clear cut. I think we will see a lot more lower ratings for GERD and a lot less higher ratings for GERD, and that's just my personal opinion. Scenario 3, you do nothing because it's not worth the squeeze. So let's say you are at 81% total, which is rounded to 80%. If you have 10% for GERD and IBS and you submitted an increase, assuming you would only receive 10% for GERD or 0% for either, nothing changes to your overall rating because 80% is 80%. The reason I bring scenario 3 to your attention is because it is imperative for you to understand your situation, okay, and what's best for you. If you decide to submit an increase for your GERD and IBS, is it possible for the VA to give you an overall lower rating? That answer is yes. Is it possible for the VA to give you an overall higher rating? That answer is also yes, okay? Which brings me to my point about how do you know what to do? The answer is always the same, okay? It's medical evidence and understanding how the VA rates that condition. In this case, it's GERD and IBS. Document your symptoms. Do not rely on the C&P examiner, okay? Document your symptoms. Go speak with your healthcare team right now after watching this. Document your symptoms with the understanding of the new rating criteria. Side note, the VA healthcare team, okay, does not give 2 craps about the VA rating changes, not even 1 bit. So don't talk about that. I want you to talk about your symptoms, seek the treatment, do all the healthcare things, take care of you, and most importantly, all of that is current medical evidence. When you submit an increase, which is what these claims would be, by the way, current evidence is not required. So you don't need to do anything to submit an increase except for submit the increase, but that is where veterans fail and ultimately hit a brick wall when the increase is denied or worse, the rating is lowered. So I'm going to list out the steps you need to do if you are considering these changes. First is understand the changes, okay? I'm going to link mental health, tinnitus, and sleep apnea and the overview of GERD and IBS right below in the pinned comment so you can check those out. Right after you decide which scenario you fall into, you either submit the intent to file now, wait until after, or do nothing. If you are a do nothing type of dude, which is where I personally fall in, then stop right here. You ain't got nothing to worry about, okay? The third thing you need to do is speak with your healthcare team. Document your symptoms, and this part is absolutely crucial. Fourth, when you are ready, submit your claim. If you submitted an intent to file prior to the changes, so scenario 1, you will need to wait for the changes to be effective. So for GERD and IBS, if you submitted the intent to file right now, you have to wait until May 20th to submit that claim to get the VA to look at both rating schedules, right? The old one, current, and the new one, which is no longer proposed. It is final for GERD and IBS. And the last thing you need to do, which is absolutely crucial, is something I call a surgical C&P exam. Meaning you have the evidence, because remember, we submitted the evidence with our increase and we understand our evidence. Medical evidence will speak for itself. So a conversation with your C&P examiner goes something like this, and this is a very blanket scenario, okay? The examiner will ask you about your mental health, and you respond with this formula. So I went to my healthcare team on month and date and spoke about symptoms X, Y, and Z. Right after that, then you go into how those symptoms affect your life and whatever it is you want to say. But by using that sort of formula, okay, it's using your evidence in your responses, which does two things. One, it makes the C&P examiner's job easier because you're referencing medical evidence and they're going to go look at it. Two, medical evidence cannot be ignored. So even if the C&P examiner ignores it, the higher level review for increases comes in clutch all the time. The higher level reviews that are granted and awarded the increase or the service connection is generally more so for increases versus service connection, okay? If the veteran has the evidence. Now take that exact scenario, right? Except for the veteran does not have evidence or current medical evidence of documented symptoms. Then the C&P examiner's word and that DBQ that's completed during that exam becomes the solo and hard truth for your claim. So by not submitting medical evidence with your increase, you're basically telling the C&P examiner, hey, my rating is yours to do with as you like, okay? And we don't like that. Now, what I am going to do is read a comment from Dr. Sharma. I have my phone out here. He gives his opinion on GERD. Now, Dr. Sharma is a psychiatrist. I get it. But GERD is a very, very common secondary to mental health, specifically on the anxiety side of the house. And he is not in favor of the GERD changes, and he explains why and looks at the rationale the VA used. So I'm just going to read this verbatim, and I'm going to try to pronounce the words as best I can, okay? So I wanted to mention my thoughts on GERD. This is Dr. Sharma. GERD is a separate disease syndrome from esophageal stricture, and I'm just going to say ES for that, esophageal stricture. One can have GERD without ES. In fact, GERD most often presents without a stricture on an endoscopy. Typically, on endoscopy for patients with GERD, the scope will visualize one of many possibilities, including esophagitis, which is inflammation, and at other times, the endoscopy will be normal. Rather than require an ES for GERD, if the VA wanted an objective evaluation for GERD, they could have required an ambulatory acid probe, barium swallow test, or esophageal manometry. Instead, the VA is requiring ES to be present within GERD, which does not make sense from a pathophysiology standpoint about what GERD actually is. Now, this is my important part because Dr. Sharma backs his argument up. He says, it's important to note that in recent studies, less than half of patients with GERD had any abnormalities on an endoscopy. Okay, so he's basically saying the VA is going to miss the mark. So more than half of patients with GERD have a normal endoscopy. And even in patients with abnormalities, esophagitis is most common, not strictures. I disagree with the VA's decision to rate GERD in this way. I did read their rationale in the PDF file. They state that they want to measure functional impairment with ES. However, GERD with the currently rated symptoms does cause significant functional impairment. Dr. Sharma is basically saying if that's the case, then why would you change how GERD is rated on the symptomology and add the ES criteria strictly to that? He's saying it doesn't make sense, okay? I think one of the most significant impairments I have seen in veterans is being woken up at night because of acid reflux and food regurgitation. It even sometimes progresses to vomiting. This is bothersome and causes fatigue during the day due to a loss of sleep. So he's pretty much saying that functional impairment already exists and there's no way for the added criteria of the ES. Now, I'm no doctor, okay, but I know Dr. Sharma is extremely smart and he can read and look at rationale and give his own rationale. So that's his 2 cents on GERD. Like I said in the beginning, I do think the changes overall for GERD, IBS, and hemorrhoids are favorable, especially if you have all 3 of them. But for GERD, I think we're going to see a lot of lower ratings, like a ton of 10% ratings for GERD, and not so much of the higher ratings for GERD, which is kind of like it is right now.